Our 5th 2022 meeting of the Health and Human Services Committee to order. Please join me for the Pledge of Allegiance. I pledge allegiance to the flag
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Thank you. We'll move on to item number 3, public comment. We have one person signed up for public comment today. It is Rick Humphreys. If you'd like to come up and state your name and address at this microphone. Oh, thank you. Name and municipality.
Rick Humphreys, Wood County. I'm here because I started going to the clubhouse in 2008 when I moved here, when I had lost my family and knew only one other person, and it became a place for family and support and a lot of things. I really want to thank all of you county board members who came to the clubhouse and actually investigated to find out what's going on there and how people feel about it, because there's human beings there. It's not just numbers and dollars. And I feel sad and worried for those of you who didn't come to make a decision of this weight to dismantle a program when you've never even visited to find out what's going on there. How can you do that? And I worry about your decision-making abilities if you didn't even bother to come and see what was going on there. I just have a couple of things. I don't think I'm going to change anybody's mind. It sounds like everybody already has made up their mind for a long time based on dollars, not necessarily based on the human cost. So I'm going to just make 3 brief points. Number 1, there's nothing else like the clubhouse. You're not replacing it. You're not offering anything that in any way is like what was at the clubhouse. You're taking away a successful program that's vital to many, many people and replacing it with what? We hope we can help you in other ways. We hope you don't get in trouble. We hope you're not isolated. Not good. I think the other thing is some of you have done the math really, really wrong. So you're saving somewhere in the neighborhood of $250,000. Do you think that you're weighing that to zero cost? Do you think when people have no place to go, where they get vital services and support and help for their mental health, that they're going to disappear? Do you think that they're all going to have another place to go or not make bad decisions or not end up in crisis? I think if you looked at one person, and I don't know the current costs in Marathon County for what it costs per day for people that are institutionalized, I'm guessing if one person that went to the clubhouse and got value out of it had to be institutionalized for a year, the cost of that one person is way beyond what you'd be paying to keep the clubhouse open for many, many people. And third of all, you have to decide if you want to give people with mental illness dignity or not. How you give them dignity is you let them make some choices on their own. You don't treat them like they're 8 years old, where all the decisions are made for them, where they have arbiters, where they call somebody and say, can I get some help? And the person on the line gets to decide, do we put you on a waiting list? Can we get in next week? Do we have to take you in the hospital? You give people their dignity and you get better citizens. You get people who can share their gifts with all of you, people that are more productive. I could try to tell you what I've gained from the clubhouse, but you don't have enough time at this meeting. I'm sorry if you've already come to a conclusion, you're dismantling it, doesn't matter. I think the cost in this community in the future is going to be much more than the cost of keeping the clubhouse going. You're going to find more people in crisis. You're going to find people making other decisions, because if there's no clubhouse and somebody's isolated in their home and they're having a bad time with their mental illness, what do you got for them? Get on a waiting list? I don't know. That's all I have to say. Thank you.
Thank you. Item number, no, the You did not sign up for public comment, so the time for public comment is over since you did not sign up. Thank you for that. We'll move on to item number 4, approval of the August 31st, 2022 Health and Human Services Committee meeting minutes. They were in your packets. Do I have a motion? Motion by Arstead, second by Covelli. Is there any discussion? Go ahead, Supervisor Crosse. Oh, microphone.
I noticed that my couple questions were blocked by John Robinson, and I just wanted to mention that there are a large swath of people who are not being helped by their psychiatric medications, whether it's depression, schizophrenia, and I know that for a fact because I have many helpers who are disabled, and I know from personal experience and friendships that their medication isn't working, and they're in and out of the crisis center, and they're calling the police quite a lot. In fact, one was moved to Lincoln County because of the harassment of the constant calls to the police department. So I think that question should have been answered, and I hope that I will not be blocked from future questions. Thank you.
Well, was that an addition or amendment you wanted to see to the minutes? Because that's what we're voting on right now.
I believe the draft mentioned that all questions were asked and answered, and my questions were not answered. Thank you.
Okay, so did you want to make an amendment to the minutes to reflect that?
I don't know if it says that in the present minutes, but it said that in the draft.
Yep, and that's what we are voting on right now. So if we vote on the draft and approve it, it will become the minutes from that meeting. So if you wanted to change something about the minutes.
Yes, I'd like to have that sentence omitted where it said that all questions were asked and answered, because mine were not answered by Chief Barnes. Thank you.
Okay, so we have a motion to amend the minutes to remove questions were asked and answered from item 7A. Is there a second? Okay, so motion dies for the failure of a second. So then that brings us back to voting on the minutes, the draft minutes as they stand. Is there any other discussion? Okay, seeing none, all those in favor say aye. Aye. Opposed?
Opposed.
Thank you. All right, moving on to item number 5, policy issues, discussion, and potential committee determination. 5A and B, today we have a panel with us. So 5A, expansion of the Crisis Assessment Response Team, or CART, and funding for additional case management for behavioral health and North Central Healthcare. We have a panel from the WASA Policing Task Force and others with us. So Supervisor Robinson, are you going to take the lead on your panel discussion today?
I will try. And thank you. We wanted to follow up on the presentation we made last month relative to the recommendations of the WASA Policing Task Force and focus in on 2 of those specific recommendations. And as you recall, the Policing Task Force had a series of almost 25 meetings, solicited public input through listening sessions, surveys, and focus groups. They had presentations from people from the statewide Professional Police Association, the Sheriff's Department, Police Department, and DA's office and others, and people from North Central Healthcare. And we developed a number of recommendations relating to trying to address the mental health needs of those people who present themselves many times to the criminal justice system, or the calls go in. And so we had made or are bringing forth for your consideration to discuss how we will advance these policies. We're not looking for immediate action, although that would be nice, but we're looking for trying to identify a process by which we can advance them. The first one is the expansion of the Crisis Assessment Response Team, or CART. CART teams have been being formed jointly with law enforcement and mental health professionals across the country, and they're very successful. In Wausau and Marathon County, We have 2 individuals from North Central Healthcare that are providing CART services, working with the police department and the sheriff's department. There's the Wausau Police Department receives crisis intervention training on how to deal with people with mental health issues that help, but ultimately we're really looking, it's not part of their job responsibility. We really need the help of professionals. The current services are available on an 8 to 5 Monday through Friday basis. And there's a need to expand those into a second shift and on weekends, 10 hours a day on weekends to try to address some of the needs in the community. The second request is for case management services, and Supervisor Crosse did a very good job of pointing out the need for case management services where people go through a revolving door, or as I would call it, the do loop there. They present themselves to the criminal justice system, they wind up at crisis, they receive treatment, they go back in the streets, and they don't follow through on their care plans, and they wind up representing themselves, and it creates a burden, and we're not addressing the needs of the community, nor are we addressing the needs of those individuals. And so one of the recommendations was to expand the case management services and assign a case manager to try to work with some of those people to make sure that they go to their appointments on time, receive the treatment that they need, follow through on the medications, and look for other ways of supporting them to minimize their contact with crisis, with the criminal justice system, and hopefully strengthen the individuals' lives and the community. And I'm joined today by representatives from the police department, Deputy Chief Barnes, the mayor, Chad, Dr. Guthrie, and Mort. We thought it would be more beneficial to have a discussion with you on the needs and develop a process forward than to just do a presentation. So I'd like to turn it over to the mayor and then.
Sure. Thank you so much once again for letting us come to your meeting. I think this is probably one of our most important partnerships. We've got a lot of them, but this one feels the most important. I'm going to keep it briefer probably than Mr. Robinson here. But I do want to express to you that the need is there. I know some of you maybe have been asking, is this a Wausau problem or does this affect people elsewhere in the county? And I'm so glad we have the chief deputy here because he's gathered some data as it relates to what kind of mental health calls we're getting out in the county too. And you can see there's a lot in Wausau, but they definitely are expanding out to those other kind of municipal areas that aren't Wausau. So again, this is a really important partnership. I'm trying to be mindful, understanding that you're working through your budget process right now, and it's tight for all of us. But this is one of those things where it's high impact. So I think that this is a great opportunity for us to partner together and serve our shared constituents and constituents that we don't know we have yet.
Sure. I just want to make sure everyone's aware of like what the current state is and what we think excellence looks like for our county. So current state is there's 2 FTEs assigned as mental health professionals who work out of the police department. Each of those mental health professionals are partnered with, one is partnered with a crisis intervention trained police officer, and one is partnered with a crisis intervention trained deputy. We have numerous deputies and police officers who are also crisis intervention trained, but these are individuals that are the sharpest point, so to speak, of individuals that are on top of mental health related issues in our community. And the goal of CART is to get better outcomes for individuals in crisis. And the side effect of better outcomes is it saves dollars because the less days hospitalized for members of our community, that saves dollars. And it's our responsibility to provide the best service we can to them. And that does not always equate to a police officer taking someone into custody and taking them to the healthcare center. So, I mean, there are a lot of people that deserve credit. I will tell you that your chief deputy was a leader in this process. He asked me to go to a meeting, and after that meeting, I said, "You just threw me under the bus." And 2.5 years worth of meetings later, we come out with this CART model. And what we found is if we have teams that involve police officers and mental health professionals, not only do they respond to individuals in crisis and can find the least restrictive path forward for that individual, working with families, coming up with solutions, because they have the time and the expertise to do that where that individual is. That's a better outcome. But then they also had the time and ability to recognize who those high utilizers of these services are. And in one particular case, we had an individual where every week we chaptered him on a 5115, and officers would have to wrestle with him, and we'd put him in handcuffs and haul him to the healthcare center, and a couple days later he'd get stabilized and come out. And what we found is if our CART teams once or twice a week stopped by his apartment and checked on him, that it prevented him from going into crisis and utilizing bed days. So when I talk about like getting the best for our citizens and keeping them the best possible result, that's what I'm talking about. And so we see significant positive impacts on what the end result of using a CART team to deal with a crisis situation is better than a police officer or a deputy responding on their own, making a phone call to the crisis center, hauling someone down there to be evaluated where they may or may not be chaptered under a 5115. We see better outcomes. We see when our CART teams are involved, we have less chapters as a result of that, and we don't see a negative effect of those less chapters. We see better service being provided to them.
Does everybody know what it means to be chaptered?
So, yes. Well, chaptering is basically we're taking someone's freedom away because they're a harm to themselves or others, and the appropriate place for someone in that scenario is in Marathon County is to go to the crisis center. So when we look at something that's working, and we ask how can we serve better our residents of this county, we know that it takes 2 CART teams to provide that service Monday through Friday, basically banker hours, 8 to 4, 9 to 5. And we can look at a heat map to say where and when are those calls for service coming into our dispatch that we're sending officers and deputies to. And we know that occurs from about 8 o'clock in the morning until about midnight is when those high utilizing times are. So there's a shift, an 8-hour shift where we don't have that mental health crisis specialist responding out to the scene with officers. So our ask on what we think would be the best possible solution to provide the best service is to add 1.5 FTEs of crisis professional staff to the CART team. So they would work out of the police department, they respond countywide. And for those evening hours, we'd have when our officers respond to a crisis call, along with them comes a professional. And I think Chad said this to me once. He said, one of the challenges with our process in Wisconsin is we send electricians to fix plumbing problems. So if all we're going to do is send an officer to a crisis situation, you're going to get the best they can do with the training that they have, or we can send a crisis professional to deal with a person in crisis. And that's where we see the better outcomes. And we know that on weekends we have 0 coverage from a CART team, and that's where the additional 0.5 FTEs for us would be, is to have someone work a 10-hour shift on Saturday and a 10-hour shift on Sunday. So at 1.5, we think we're going to continue to see the same outcomes and success that our CART team experiences right now. We'll just see it amplified, and there'd be a significant return on investment in the number of chapters and, more importantly, the actual service we're giving to individuals and helping them remain out of crisis. So that's the crisis end of it.
I guess I'm just here for questions. They've summed up a lot of what the CART team is. Just to give you a little bit more background on it, the CART team actually came out of an idea because Laura Scudari, who's now your health officer, used to work for North Central. We attended a CIT international training in Chicago, saw this model and said, wow, this could really have an impact. But all the models we saw were big city models. So what we did was we researched these models from Milwaukee, Madison, Brown County, and we morphed ours into what works here in Marathon County in light of the systems that we have. Laura having the background with North Central and how they operated during that time, and then myself with the law enforcement side. And then we had partnerships with the Community Foundation and the Greenheck Foundation. And they were the ones that bought the vehicles. So the squads that you see running are grant funded or community funded is what they are. So it really has been a community project and program. And I think that's why you hear so many positive things about it, because they are called on a lot because the community knows who they are. So CART is, we hear CART and we might just generalize what CART is, but CART has a lot of community support behind it. So other than that, I'm open to answer any questions.
I think there might be 2 mics up there too. Okay.
Thank you for inviting us to this important discussion. I'm Morton McBain. I'm the interim director at North Central right now, and beside me is Dr. Rob Guthrow, who's our chief medical officer for North Central. And we've talked about this before we came to the meeting. Obviously, we talked about, well, what can we do to help? And as is typical with many things that we fund and that the county provides, it really comes down to a question of resources. We're looking for more services to be funded, and that's good. I think it's good that we're discussing a program that's already got a track record of success, basically. And this model, I know, has been in many other communities successfully, and we're now there too. So the bottom line question for us, and we're anticipating this question from any of you, is where can we find resources to expand the program? And that's basically what we're talking about here. So I'll just leave it at that for my part, and I'll ask Dr. Guthrow to just take you through a very brief explanation of how we see CART services being provided in this community now and potentially in the future. Okay.
Yeah, I will just say I concur with everything that's been said. I don't know if there's much that I can add. I think the last time I was here last month, I talked about meeting people where they are, and that is not necessarily in a physical, wasn't necessarily meant in a physical sense, but if we can do both and meet them where they are in regards to their mental health and the location where they are before they go through the traumatic experience of having their rights taken away and going to a crisis center and being evaluated in a place that is foreign and unfamiliar and a very difficult time, we're going to have better outcomes. So we send people with the experience out into the field to help people in their time of need. We can avoid a lot of that. We have CART now. We don't have enough. I mean, that it's working now. The people that we have on the CART team from North Central Healthcare are very invested in what they do, and I think they do extremely good work. We talk about resources, and obviously there's the financial side, there is the staffing side, but if this is something that is deemed that we can and should move forward with, we will work to make it happen.
I think what we're looking for today is just an expression of support for expansion of the CART, understanding that that doesn't come up with the resources, but to begin to evaluate what the options are for funding it into the future. One of the potential funding sources would be the behavioral health component of the ARPA dollars on an interim basis, but we can look at, there's a potential to recover some revenues from the people that receive the services through the program, although many of them, quite honestly, don't have insurance, and but we can evaluate those options. But what we're looking for is the ability to move it on in the system to evaluate how we can pay for that on a longer term basis and address those needs. And relative to the second issue, which gets into that whole issue of perhaps meeting people where they're at and providing that service, is that issue of case management. It's much more complex. We recognize that North Central Healthcare is going through an evaluation of their structure and how they provide services and how those are organized. And we would look to a model that was used at the jail, both in the context of when we had some issues within the jail And then when we had some issues relative to the mental health services provided through North Central to the jail, and work groups were formed. And those work groups were highly focused, and they looked at what the options were, and they developed recommendations. That might be a good approach to allow North Central to continue their evaluation relative to structure and other things. But to have that issue, one of the things we talked about, I was on one of those work groups, was making sure that when people are discharged from the jail that there was a discharge plan and there was follow-through. Well, we're asking for a similar type approach here. You can't just release people and not and say, well, you've got a doctor's appointment in 2 weeks, show up. These people aren't likely to show up. We need to make sure that they're managed, and we spend a little bit more time so that they don't become part of that revolving do loop, if you will. And so I turn it over to Matt, who's got some great stories.
I do? Okay.
Well, you did last week.
So, when I look at who we see in crisis and who in our community is suffering from significant mental health related issues, frequently there's a co-occurring disorder and they have alcohol, AODA related issues as well. And the frequency at which those high utilizers are either ending up incarcerated in our jail at an expense to this community or hospitalized, including medical clearance, at an expense to our community, that number is unacceptable to us. And we look at what are some of the barriers preventing individuals from being able to function normally in our society and not need those interventions with law enforcement. It seems self-serving, but we don't think law enforcement is the right response to all those situations. And at the end of the day, it's someone that's meeting them where they are. I love that statement because when we're dealing with very high utilizers, the idea that they're going to make it to an appointment 3 weeks from now on a Tuesday to meet with a case manager to talk about their issues, and then they're a no-call, no-show because they forgot about that meeting a long time ago. So we know that when we've had staff or worked with individuals who are practicing case management and know that there's an appointment going up and make sure they go to where that individual is going to be. And if they're not there, they go find them to be able to make sure that their needs are being met and that there's proper guidance, that the appropriate medications are being taken to keep them out of the jail and to keep them out of the crisis center. We see much better positive outcomes. And just recently, within the last week, an example of that would be we had an individual show up in Wausau. 17 times Wausau police officers were called to deal with her, which included police officers finding a pair of pants for her to be wearing. And this is a 50-year-old woman who suffers from significant schizophrenia and multiple medical clearances. Ultimately, she ended up in the Marathon County Jail. And upon getting out of jail, we have a caseworker working for us, and that's not her title, but she works with homeless individuals, and here's this person that's been here for 3 days that doesn't have a home. And through sitting down and working through her mental health issues, found out that originally she's from Colorado. Her 70 or 80-year-old mother in Colorado didn't know where she was, didn't understand how she'd end up in Wausau, but made that connection between this woman and her mother who cares for her. And the mother hopped on an airplane, flew to Green Bay, rented a car, drove to Wausau, picked up her daughter, drove her back to Green Bay. They both got on an airplane and they're back in Colorado where this individual is receiving services. If the solution is we schedule an appointment weeks out to meet with a case manager and deal with those situations, we're not doing the best we can. So when I see the positive impact of CART and the little bit of case management they do connecting with people, and the positive outcomes. The idea, if whatever the case management process is that's provided here in Marathon County, it has to meet people where they are, and we have to get positive outcomes, and it can't just be a no-call, no-show, because those are the individuals. It feels like Groundhog Day, every day the same thing over and over again, and I am absolutely convinced that we can do better than that.
I guess I also want to mention that it's not just adults that we're working with, that this team would be working with. I did a ride along on a holiday one year because I like doing that stuff, I guess. And the first call we got was for, it was a kid who called. He was scared. He said somebody was trying to break into his house. And we got there, and this wasn't the case. He was he was a kid. His mom was under the influence of something and wasn't able to respond to his needs. But he was safe, he was okay, and in the meantime, there were some other things going on in Wausau that needed immediate attention. It was an emergency, so we tried to reassure this kid that he was okay, and then we left. And he called 911. Maybe 5 more times that night. He was terrified. And so it's one of those things where this is, it's 11 o'clock at night and he's dealing with this on his own. And if we could have a CART officer or mental health person kind of working with them, I think we'd get to a better place for that kid. And then that same night, we were transporting somebody from the hospital back to the juvenile detention center because she had tried to kill herself. And that's one of those things where, requires a police officer to do that transport. So again, there's a lot that goes into this. And I also want to just recognize that there are many children who get caught in this system too. And it's really important that we can help them.
Let me just change the trajectory of the conversation just slightly and go to what we can call the 30,000-foot level, okay? Just briefly. You're probably aware, recently North Central Healthcare tried to recruit a permanent CEO so I could leave and go back to my garden. We were unsuccessful, ultimately. But that experience caused us to look at our organization structure and ask ourselves the questions: what are we trying to recruit for? Who are we trying to recruit for at North Central? What do we want from that person? And that led to a consultation with an expert in human services from the state who met with our executive committee and our staff, our senior staff, and took us through an exercise which culminated in our changing and proposing to change some of our organizational approach to how we work with the counties. North Central Healthcare is a 3-county organization. We work for 3 different counties under contract in many cases for specific services. Counties are legally obligated to provide those services, and North Central Healthcare fills that need by contracting with us to provide those services that are required under law, including Chapter 5142. So the long and short story of what I'm saying here is that we are currently engaged in a reassessment of who we are at North Central, what we do, and how can we serve the counties better. I would say this is close to Supervisor Robinson's dream at this point. Maybe it's a vision. But we've known for many years that there's a kind of a disconnect between the counties at times and North Central in terms of, well, what is North Central supposed to provide? And how do we communicate with the counties, and how do they communicate with us? So I can tell you that we're working on this issue. It's not necessarily germane to today's discussion, but it is long-term part of the solution, I think. As we restructure North Central, including the committee structure and the senior staff, we are pivoting closer to what I would call the ideal county model, which is where our corporate culture, if you like, is attuned to serving the counties. And that's where we're going right now. And to the extent that that's successful, and I think it will be, that will go a long way to answering some of these long-standing issues between the counties and North Central in terms of what are you providing, what could you do better, how can we communicate with you better as to our needs. So we're kind of moving along that path, but like anything, it's a slow process, but we're on that path to changing and refocusing some of the things that we do to better serve the counties. So with that, I'll just stop.
I think the administrator would like to make a few comments, then I'm hoping the panel will be open to questions.
Yeah, I'll just build on what Mort referenced. So as you may or may not know, I not only serve as the Marathon County Administrator, but as Mort referenced, I also serve on the Executive Committee at North Central Healthcare, and I can't say it any better than what Mort did about the process we've been going through, but I think I have good news. I think Supervisor Robinson framed it up very well, that this is an important start of an ongoing conversation. The good news I have for you, because I know you're all going to at some point look to me and say, hey, where do we find new money? I don't have new money, but the good news is we spend a fair amount of money right now delivering services that we can just do it a little better, do it a little differently. Like Mort said, change our focus. We interact with a lot of individuals through North Central and through the county, and certainly the city does as well. And how we frame those interactions and what does success look like, the better we can term that for staff, I think will yield those dividends. So I think this is very helpful, and I appreciate also that the task force sent through some data this morning that I was looking at relative to kind of that heat map of where the calls come in, and also the time of day to look at what is that, let's evaluate everything. I'm a big fan of brainstorming and looking at things differently. We have 2 CART teams, according to the data Chad sent. It's about 1,375 calls have come in thus far through the start of October. So you're talking 5 calls per day based on that. I know the CART also does a lot of things outside of actually the calls that come in. But how can we look at that data? How can we assess what our needs are and perhaps look at new and innovative ways, not only with respect to CART, but also with respect to, as Dr. Guthrie said, meeting people where they are, both literally and kind of more from a mindset. But I think it's great to have that conversation. And as Mort referenced, one of the things that we are doing differently, proposing to do differently through North Central, is really try to strengthen that relationship, because there's a lot of money, as Matt said, there's money we spend. And I like to think of the county budget as a balloon. And when you squeeze one part, it's not like you squeeze air out. It shows up somewhere else. If we're not doing a great job in one area, it'll manifest itself through either the juvenile justice system, our CPS system, the jail. So we all need to be thinking about how do we spend our money better. If you have any ideas as to how to get the state to give us new money, I love that as well. But right now, let's talk about how do we spend the money we have perhaps a little bit more intelligently. And then this is a great start of a conversation with this committee on that.
Okay, with that, I think we'll open it up to questions. And I just want to kick us off with one of them that I think maybe all of us are thinking. Do you have projections on the cost of this? Well, I would say both CART and then additional case management. Is there an estimate that we're looking at?
I can give you ballparks, if you'd like. So CART, from the North Central Healthcare perspective, per FTE, would probably be around $75,000. And targeted case management, which I'm not sure it's everything that you're describing, but I think it's a program that would add significant value to our patients that have more intersection between mental health issues and legal issues. The way our current structure is set up, that is a gap that we have. And targeted case management, I think, is something that Laura Scuderi probably investigated independently back when she was there, and she came to that solution. And then 3 years ago, when I came to North Central Healthcare, we did another investigation and came to that solution, and then said, hey, has this been looked into before? Turns out it was, and both answers were the same: targeted case management. Targeted case management, the last time we did a cost estimate, which was, I don't know, maybe 6 months ago, thereabouts, just over $200,000. And the size of the program, the scope of the program, how many counties that it would cover, et cetera, would affect that number. It does generate some revenue, but probably not enough to cover its complete costs. But again, if we help people before Matt Barnes is called or before the sheriff is called, we're going to be saving resources elsewhere, not just financial resources, but people are at a premium right now. And every time an officer is dealing with a call for mental health, they can't deal with something else. So those would be my estimates on cost.
Thank you, that's helpful. Supervisor Covelli, did you have a question?
Thank you, Madam Chair. And thank you, Lance, for answering one of my questions about the number of calls. So that got taken care of. It seems to me, and I'm a fan of the CART program for anyone that was down at the Wisconsin Counties Association conference. And they had, I believe it was Milwaukee County, closed a clinic. And was it Milwaukee County? And they closed a clinic because the CART program down there, I don't know if they call it CART, I don't remember, was so successful that they no longer needed that clinic. They opened up some satellite offices in the neighborhoods where there were problem areas where people could go to utilize those services, which I thought was a great idea. One thing that I see that's a little bit ironic here is that we're closing Community Corner Clubhouse, and if you turn around and look at the folks that utilize that facility, I don't know if you've seen them in the back here. It seems kind of ironic that we're talking about, helping people with mental illness, but we're closing a facility that helps people with mental illness. We're not funding it. So I think that's a little bit ironic and a little disappointing to me that we're asking for more funds to help the CART program and not help the Community Corner Clubhouse. I think that's all I have for right now. Thank you.
Administrator Leonard. And
I
then
just
Supervisor
wanted to
Crosse.
piggyback. The WCA conference, another great example of, and I had this conversation certainly with Supervisor Arstead and I believe Supervisor Marash. There's a lot of things we're doing that you'll see at the conference, and La Crosse County was the one that had their, I wrote it down, co-responder program. If anyone attended that, that is essentially, they patterned that program after very similar to what Matt, Laura, and Chad put together here. So another great example of the benefits that other counties are patterning after us.
Supervisor Crosse.
If I could on that note, could I ask Chad to respond just the difference in the jail populations between La Crosse County and Marathon County?
This is on, right? Okay, good. I have my counterpart in La Crosse County, and I have regular conversations. And 2 weeks ago, we were talking about, of all things, the fleet and vehicles and some of these things. And I said, hey, I got to ask you, Mike, what is your jail population today in La Crosse? And La Crosse is a very comparable community to Wausau, 110 inmates. On that day, we had 303. So there are programs, there are things we need to be looking at, and I think La Crosse is a leader in that area, and they do some really innovative things there. And the way that their government body, we'll just say the sheriff's office, works with local hospitals and their human services department, they're structured differently than we are. There's benefit there. So that we need to bolster that. And I think that's where some of that comes from.
Supervisor Crosse, you have a question?
Thank you. I was wondering if you've ever considered other types of therapy. I got my master's in Adlerian psychology, and I know there's Gestalt. Not everyone is set up for talk therapy. There's lots of people who don't want to sit and talk to one person week after week for an hour. They may not feel it's helpful. And another approach that you're using is psychiatric meds, which doesn't always work for everyone. Not everybody wants to pop a pill every day, or they forget, and there were other reasons mentioned. There's other types of therapy that do work for people with psychiatric problems, such as hair analysis, nutritional deficiencies, blood tests, acupuncture, aromatherapy, chiropractic, diet, allergic reactions to MSG, which includes violence and depression and suicidal behaviors, recreation, nature, movement, exercise, forest bathing, Reiki. And I'm wondering if you can't add some of this into your staff, because acupuncture is being covered now. Some of all these other therapies are being covered. And like I said, psychiatric meds may not be working for everyone, or talk therapy. So I was wondering if you might be able to look into some of these other avenues. And I had talked to for my MBA, I interviewed the executive in North Central Healthcare, CEO, prior to Mr. Loy. And he said that there was one psychiatrist that did use some alternative. I think it was aromatherapy, but and I do know myself that aromatherapy changes mood. It brings people, gives them energy where they're lethargic or low in energy. So there's all kinds of these other modalities that might be helping some of these people, so they won't be need to be use this CIT or CART model at all. Thank you.
Yeah, I could talk about this all day, and I know we don't have unlimited time to discuss different approaches to helping people become better. We're complicated beings, and if a pill solved everything, we wouldn't all be sitting here talking about this. Medications have their place for certain people, but not everyone responds to medications the way we would hope. I think North Central Healthcare's role is really to help facilitate finding the best ways to have people improve. And diet, exercise, sunshine, vitamin D, all those things are extremely important. Socialization, very important to help people become who they want to be and be where they want to be. When you talk about CART, part of their role is to help guide people towards what makes them well before they come to the crisis center. And unfortunately, when people are moved from a situation that might be more comfortable into a place that they're unfamiliar with and they feel uncomfortable, the likelihood of medications being used increases significantly. If we can meet them in the community and have somebody who is skilled at working with people that are in crises, we may be able to help guide them to alternative therapies, which would be more appropriate for them. So I don't think they're exclusionary. I think they actually walk hand in hand pretty well.
Thank you. Are there other questions? Supervisor Marash? Could somebody hand her a microphone? Thank you.
Thank you, Madam Chair. With what Ron said too, I hear you guys talk, and I 100% agree that we need to expand CART. With that said, I would really like to see a way to expand CART, but also incorporate that somehow, brainstorming to keep Community Clubhouse, because it's already a program that has a track record of success, as you said, in reference to something else, but it still refers to this. Meeting people where they are before things become a crisis. We've heard time and time again from the people that use the clubhouse that without it, they will be in crisis. So we will have additional users of CART, possibly, if we don't have this, where they can help each other before it becomes a crisis. We have multiple users from different counties that come and use Community Clubhouse. People drove as far as, wasn't it Madison, to talk when we did the listening session. We have this gentleman from Wood County today. If we get rid of that, we're going to have more people in crisis. So I would like to see somehow expanding CART, incorporating the clubhouse scenario. Thank you.
Go ahead.
I'd just like to wear my county board hat versus my policing task force chair hat. The budget is the administrator's budget until next Wednesday. After next Wednesday, it becomes the county board's budget. The county board to date has not voted on community clubhouse and its funding. That's a decision that was made in the budget process. And if you have different priorities, that is a time to raise it. I think what we're before you today to bring forth two critical needs that were developed over the last year and a half, 2 years. And quite honestly, we're present before that in terms of the need to expand CART into the evening hours and weekends, and to have that active case management services. And put things in perspective, when people are discharged from the jail, they get a discharge plan. If there's follow-up that's necessary, we don't follow up, but there is a plan developed by...
If they want to cooperate.
If they cooperate. But we have a plan. What we're asking is when we're in that situation with crisis services and others, that we develop that plan, but also to follow up on that. And we see those as critical needs. The issues relative to community clubhouse are separate issues. There is value in that program, and you'll get a report later in the meeting, but the time for the county board to determine those priorities is in the next couple of weeks, or a few weeks. But again, I think what we're looking for is a process, and I commend Mort and the staff at North Central Healthcare for their commitment to looking for that continuous quality improvement and building off the efforts that we've had in the past with Laura and others. But there is a critical need to provide those support services so that they don't present to the police department, wind up in jail or at the crisis through a 5115 commitment, get treatment and get released, and then have no follow-through. We have to make sure we've got that follow-through. And we have to make sure that when they respond to those situations, that we've got the most appropriate professionals responding, therefore the expansion of the CART. And I think what we're looking for is just a feeling of the committee as to whether or not these are meritorious programs to advance and to identify a process by which they can be accomplished.
Thank you. Mayor Rosenberg, did you have something?
Yeah, I feel like I'm sitting on my hands. I don't want to tell you how to spend your money or what your priorities should be, but I think it's pretty clear. Like I'm emotionally invested in this community corner clubhouse discussion too, and I would hate for this discussion to turn into one versus the other, because the reality is we need both. So that's where I'm standing here. If you need me to advocate with you, I will. But I'm not always probably the right person to advocate to your board. So, but whatever you need from me, I'm here.
Thank you. Are there any other questions for the panel? Supervisor Covelli.
I just have a comment. Thank you, Madam Chair. And I agree with Mayor Rosenberg. I think we need both. And I think we should really look at funding, coming up with funding for both, because I think they kind of work hand in hand from the discussion that the panel has presented. They absolutely work hand in hand, in my view, and I believe probably the folks that are in the audience in their view as well. So I think I think Mayor Rosenberg was right on key with we should look at funding both. Thank you.
Thank you. So I think what we are looking for today would just be a vote of support towards exploring an expansion. Is that what you're looking for, Supervisor Robinson? Team? Okay. So we would need to vote on each of these separately, correct? Okay. So if there are no other questions or discussion, then we will start with item 5A. If anyone has a motion to support exploring the expansion of the crisis assessment response team. Okay, motion by Leahy, second by Niemeyer. Is there any discussion? Okay, all those in favor say aye. Aye. Kelly, is Supervisor Gonring still on? Yes. Okay. All right, then motion carries. We will move on to item 5B, funding for additional case management for behavioral health at North Central Healthcare. And we are looking for a similar motion to support the exploration of funding for additional case management. Supervisor Arstead with the motion, second by Supervisor Covelli. Is there a discussion? All right, all those in favor say aye. Aye.
Aye.
Opposed? All right, motion carries. Thank you. for joining us today. Thank you for your insight. I look forward to hearing what comes next. I'm going to just let them, are they not exiting? Okay, so we will move on to item 5C, Family Keys Housing for Child Welfare Families Plan Revision. And I believe we have Administrator Leonard and Director Tilka with us here today. Do you want a microphone? Is that okay?
Yeah, this is great, thanks. Okay, so following those great discussions about programs that help people in our community, this one lines up with that beautifully as well. So we are moving forward with a proposal for a revised plan for Family Keys. And of course, the committee will remember that we talked about this previously, and in July, the county board did not pass with a 2/3 vote, but there was a majority of the county board who supported accepting of the grant. And so we went back to the drawing board to address the concerns that were brought to us by the members of the county board with concerns. And so the specific, just to remind people and ground people what we're talking about with Family Keys, is this is a collaboration of communities, partners, counties, 3 counties, and the State Department of Children and Families regarding supporting child welfare families to be able to access housing. And so specifically, it's only those families who are involved in the child welfare system. And so our phase 1, we were asked to be a partner with this with the Department of Children and Families and to submit a plan that could support families immediately with housing in Marathon County. And so with the board vote in July, we were asked to continue participation in the program and then to revise our plan that would make it effective January of 2023. So we would still be eligible to receive the grant for $327,000 with the one-time funds that are federal funds, and they're federal funds that have been shared with each state to be able to support the states in implementing Family First Prevention Services Act, which again is the federal act that is basically requiring states to look at how they are serving children in child welfare differently and requiring us to serve more children in home rather than out of home care. The phase 2 of the program, so this is a multi-year opportunity. Phase 2 allows the counties to build longer-term partnerships for a longer-term solution involving private-public partnerships to be able to better address housing for families as a whole. Am I clicking? Thank you. All right. So the first piece that we addressed was regarding concerns with safety and congregate care. And as I am sure the committee remembers that our Department of Children and Families, law enforcement did not share the concern of safety in that environment, but we did listen to the concerns that people were bringing forward in terms of families living together in one setting. So we looked at revising our plan, and what we are proposing at this point is more of what is called a scattered site model. So renting single-family units throughout Marathon County rather than the congregate setting. So the challenge there is the housing itself is still expensive in terms of the market in our area, in all areas, but in Marathon County in particular. So it still will be difficult to find single-family housing units available to be able to rent, which is why we had our original thought process of the congregate housing. But in this model, one benefit would be for us to be able to rent units for a year at a time, which would make it, we think, more likely that landlords would rent for this program because they would have the security of having that rent be tied down for a full year at a time and making it more achievable for us to be able to access apartments. The other benefit of this would be that locations could potentially occur in rural Marathon County rather than just in Wausau in one site, so that there could be some apartments in other areas. The flip side to that, a lot of this is pros and cons. The flip side to that is transportation, of course, would be a greater challenge to those living in rural areas to be able to get to services and employment. And so that would have to be addressed, but it's potential that that could occur. So that's regarding the actual living setting. The next major concern that was brought up was risk to the county in terms of addressing, again, that financial risk if the county was to act as a renter. So in a revised plan, we have clarified that a contracted agency through funds with the grant would assume that responsibility. And they would be the ones that would literally locate the single-family housing units for rent, and they would negotiate and sign that rental unit or the leases with the landlord for those rental units. And while that's important is because a reminder that a number of our clients don't have a good rental history, and so they're being turned down to the ability to be able to rent the apartments. And this way, if it's done through kind of like a broker, I guess, in another word, the landlord's agreement is with that entity, so there'll probably be more security on behalf of the landlord to be able to do that, understanding fully that we will have child welfare families in those settings. And then they would also be responsible to oversee those agreements to make sure that they're following guidelines and that type of thing. And they would have a case manager who would work specifically with our social workers that would continue to be assigned to work with the family for up to a year under the court order. The other concern that came up was the duration of the program itself, and just the concern that families would want to live in the rented setting for an ongoing basis, and we would have a hard time having them move on and would ask to have the program continued. So just to clarify, the occupancy is temporary, it's based on the need of the family, and is controlled by social services. So we'd be recommending different people for rental based on the fact that they've met the conditions of their court order that were put into place as their children were removed, and now they are done everything that they needed to do to be able to respond to their court orders, and so housing is their only last barrier, and so that's how they would become eligible, and obviously they'd be cooperative with all the terms that we would have in place, and then including working with the case manager from the agency that would address those barriers to where the family's going to go for their next step, because we do want to see them situated in a more permanent setting before we would close our case with them, and that's why we use the thought process of families would stay in this temporary setting for 3 to 9 months. That's a very rough estimate, but when you look at the fact that we want to see our families be stabilized in their next setting that would be more permanent for them, we have a year to make that happen. So again, they would be in this setting for a short period of time. The other thing to remember is the grant itself is only, well, it's 2 years in total, but we get the money 1 year at a time. So I always do that as a caution. We expect that we would get it for both years, but that really is the grant itself. And so the shorter occupancies that we have for families, the more families we can help. And this is all about helping our child welfare families. So we're actually motivated to have people move out to their next more permanent setting as soon as possible. The other good thing about this revision is that potentially, if families could afford the rent, if we find, and when I say we, it would be our contract agency, finds a single-family unit that could be affordable for families to assume the lease, they could stay where they were, and they wouldn't have to move. And they would have shown that they had that positive rental history, and they would be able to take over that lease, and they wouldn't have to relocate. So that is one benefit of this revision as well.
So Vicki did a great job. I don't know that I have anything to add other than thank you for the opportunity. We did have, our staff did a great job sitting down and really trying to, be true to the concerns that were expressed. And I'm very happy with the revised proposal that DCF and our staff were able to put together. And the ask I would have, if it's something you're interested in moving forward, it would be very similar to what you just did with the proposals before. That would be a motion directing me to include this program within the proposed 2023 budget. Now, as Vicki alluded to, the funds would come in, they would be expended as well. So it's an in and an out. We're going to have a revenue corresponding with the grant funds and corresponding expenditures, but I really don't have anything to add on the program. Vicki did a great job. The slides lay out, the concerns that were expressed, and then the things that staff working with DCF really have put together in terms of a proposal, a revised proposal to address each of those concerns. And as Vicki said, I think there are some certain things that are very positive. Just looking at this last slide, if a family moves into working with our contract agency for housing, they locate a place, they're there for, let's just say, 3 months, working through, they complete everything they need to with Vicki's team, they can stay if it's something that fits into their family budget, and there isn't that additional issue that might come from having to move out. So I think there are certainly some aspects of that revision that are positive, but that's kind of where we are in terms of process, and what would be necessary to move this forward and have it included in the budget. Yeah.
I forgot to say that the Social Service Board passed this revision unanimously at its last meeting. And then also, I just want to reiterate the Phase 1 and Phase 2, because there were a number of comments from County Board indicating that they felt housing projects should be supported by people in the private sector. And if we continue in this grant, or we're continuing the planning, but if we are in the actual implementation of the grant, we have the ability to do the Phase 2 where there's more resources to bring to the table to be able to do that broader a solution that would involve private partners as well. So we don't get to do the Phase 2 if we don't get to do the Phase 1. So this is all part of the project.
And then we'd be happy to answer any questions you might have.
What questions do we have? Supervisor Cavelli.
Thank you, Madam Chair, and thank you, Vicki, for that presentation. I think it looks much better than it did in the past. And I did attend the similar presentation from La Crosse County, right? Down at the Wisconsin Counties Association, and they do have similar program that you're calling out here. Outside of, they also look for hotels and things like that to contract with for these families as well. They did mention that there were families that had kids going out of state for care versus staying in state. Question that I have on the contracted agency, is that funded through this grant as well? Okay. I think that's all I have. Thank you.
Great. Supervisor Marash.
Thank you, Madam Chair. Thank you very much for all of your revisions. I appreciate them, and I think it looks much better this time. As you know, my concern was the congregate living was the main one. Questions are, 1, will the participants be contributing to their rent so that they will be more likely to succeed and build rental security? That's 1. And the second one is, will the board receive periodic updates regarding the KEYS program itself and how the Phase 2 process is going?
Well, first of all, I love to talk about our programs all the time. So the answer to the second one is yes, absolutely. Try to stop me. I love telling where we are with our programs, the outcomes, what's working, all those kinds of things. So absolutely. And the first question was regarding say that again, the first one? The rent, yes. We have not set our policies yet. We're doing, continue to do different research. And we know that there's one local model that people have talked about where folks are saving like 30% of their income and not paying it towards the housing unit, but they're saving it into a savings. So they will be paying some equivalent. We haven't set what that amount actually is, but they won't be using it for the rent. They'll be saving it for their rent in the future. So they will be required to do that. Oh, okay. Because the grant's going to pay for the rent. That's right, to start it out.
Other questions? I had one. What if we can't, or the contracted agency can't find housing? Because we know that rental housing is difficult right now. Then what?
Well, the more expensive the housing will be the less housing units we can rent. But we would intend to find some. There have been discussions with different landlords, and we think, and again, we don't have our contract agency ready to go because none of this has been approved. So it's been more theoretical discussions at this point. But they're optimistic they'll find some things. I think the question will be how many bedrooms. per unit, because we will have some larger families too. So that's probably more of the concern. They're feeling like they will find something, and we'll see what the price is, but find something that helps.
Thank you. Any other questions or comments from the committee? Supervisor Hart, could you guys hand him a microphone?
Thank you, Madam Chair. I serve on the Social Services Board, so I've been through this presentation before, and I just, again, want to thank Vicki and her team for revising this. I think this is a really good program, and I just wanted it to be noted, I did ask at Social Services what we lost, and were we going to be impacted by, maybe receiving less of the grant or anything by not accepting it before? And the answer overall was no. The only thing that was really lost was we have families right now, kids who are not being reunited with their parents at this time, who, if this gets passed through, will be, but it'll be delayed by a few months. And I just want to put the human cost of, that delay. But I do think that this is a better program, and like I said, I want to appreciate and show appreciation to the social services team for putting this together. So thank you.
Thank you. Supervisor Crosse?
Yes, thank you, Chair. And I was wondering, I don't know if this question has been answered before, but in the previous plan, there was where they would meet with their social worker or counselor on a daily basis. And I'm wondering, with this type of program, this second plan, if that's still going to happen.
That's a great question, and that is one of the negatives. They will not be meeting with their social worker as often, or staff from the Department of Social Services as often, because in the model with the congregate care, we would be able to have multiple staff assigned to drop in at one location. Now, with people spread out, the individual social workers that are assigned to those families have families all over the community, so they just will not, with the caseloads they have, be able to see them as often. So, astute question. We'll still provide the level of case management that we can, and then the case manager position that we're contracting for, we will be wanting them to see the families very regularly as well.
Thank you.
Supervisor Arstead?
Thank you, Madam Chair. So, do we have a number of families in the wings right now waiting? And you said that this would be starting in January, but not before then.
Correct. We have time to, we have to go out for a quote for the contract agency that's going to help with this, give them time to get some rental units, sign leases, that type of thing. And we don't have our final plan with the Department of Children and Families yet, awaiting our county board approval. So that's where we are with that. And did I miss another part that you said? I'm sorry.
The families.
Oh, yes. And that's a really hard thing to, we do have families right now who've met their court-ordered conditions, and housing is the barrier, right? For me to say how many at any given time, it changes, right? And also the families have to be willing to want to be in this program. They have to be willing to follow the rules that are going to be in those places, that kind of thing. And we didn't go forward to that level of degree back in July because we didn't have the approval, and we didn't want to set families up for disappointment. So our evaluation of how many families are eligible are going to base on our social workers making that determination themselves without talking with the families already. And that's why the number is not secure or doesn't stay the same, right? So when I've talked at different times, I was receiving that information from our child welfare manager that these are the number of families potentially that could qualify for this. But it will change over time as families find other options potentially, right? Or other families are coming on and meeting their court order conditions. So not static.
All right, any other questions or comments? Okay, so as Administrator Leonard said, today from our committee, we are looking for a motion to instruct the administrator to put it in the budget for 2023. That's what you like? All right, so do we have a motion? A motion by Leahy, is there a second? Second by Covelli. Is there any other discussion? Supervisor Arstead?
So will this be going to the county board?
Ultimately, your budget is approved by the county board, so the answer there is yes. I have asked every committee, and you may recall, I'm 99.9% sure I remember doing it here, that if you wanted to create a new program, terminate an existing program, expand an existing program, or kind of decrease the scope of an existing program, I asked all the committees to provide me that direction. That's what I'm asking for from the committee today. My intent is not to take this then to the county board for purposes of building the budget. I will deliver my budget actually next week to HR Finance and Property. And then it's going to be as Supervisor Robinson referenced, once I turn it over, it is no longer mine. And you as supervisors will do with it what you please. So it's really just to provide me direction in this kind of last, at the 5-yard line as I put the finishing touches on the budget.
Okay, any other questions before we vote? So all those in favor for instructing the administrator to add the Family Keys grant into the 2023 budget, say aye. Aye.
Aye.
Opposed? All right, motion carries. Thank you, Vicki. All right, moving on to item number 6, operational functions required by statute, ordinance, or resolution. We have none today. Item 7, educational presentations and committee discussion. 7A, update on Community Corner Clubhouse and other North Central healthcare programs. We have Mort McBain with us.
Thank you, Madam Chair. Last time we met with the committee, we promised to bring back an update report on where we are with Clubhouse. And so Dr. Guthrie and I are here today to do that. And since we last met, we've had lots of discussions and things have transpired, and we've come up with some plans that we think will satisfy the need for this type of service in the community, not specifically with Clubhouse, but something similar. In fact, there are several options that we are continuing to look at. So with that, I'm going to have Dr. Guthrie go through and tell you where we're at today.
After we met last time, I talked about 3 things, purpose, structure, and support. I think everybody needs it. Said that before. But it's true. And when you looked at the list of other programs that were provided as alternatives to Clubhouse, they checked some of those boxes, but not all those boxes. So we went back and we got together and talked about what can we do differently. Is there a way we can provide, the support, some socialization, some structure, some purpose that doesn't duplicate things that are done in the community? And we looked at the number of people we're serving at this time. How could we find something that worked to provide an opportunity for people to come together, to work on projects together, to socialize, to meet some of these needs in a different venue, in a different way? And as we worked on it and brought in and obviously talked to the manager, Mike Frankel of Clubhouse, also, I think the members were doing their own soul searching and looking into what the future might be without Clubhouse, and those 2 paths, I think, began to diverge. And we had a conversation with Mike, I don't know, a week ago maybe, and it seems that it may be better in the end for these needs to be met through a program that's not located at North Central Healthcare. We talked about alternative locations where we could have people come and meet, again, given the number of people that currently utilize Clubhouse, and there are challenges to a number of them. North Central Healthcare being one of them, to be quite honest. Some of the people, have received care there. Parts of their life that maybe they don't want to relive or recall on a regular basis by attending there. They don't want to be reminded of some of that prior trauma. Some people, my understanding, and working with Mike and others, are looking into how can we recreate some of this somewhere else. And when you look at what North Central does and how we have a limit on the resources that are available, and we're not as flexible as we could be, or as a program like this needs to be, it really does seem, as we think about it, that this type of program is better provided through alternative services, not through North Central Healthcare. North Central Healthcare really should be the facilitator of these services to bring the community together, other partners in the community and the county together to help people connect. We have a list here, and we have been reaching out to organizations that maybe we didn't think of quite as much in the past to see what they could do to provide some of what will be lacking when Clubhouse goes away. At the same time, my personal belief for some time has been that this is a program that should be provided a small, flexible nonprofit in the community. And Mike Frankel has begun to think about how he may work in the future to build something like this on a more personal level outside of our organization. Now, I can't guarantee that that will happen, but that is really where, in my opinion, these needs should be met. Until something like that does arise to fully replace what the vision of Clubhouse is, some of the additional resources that we've come up with, Mike did some work and Mort went to visit the Marathon County Literature Council, and they have offered their space. They're open 9 to 4. They have many resources, internet, computers, life skills, education, tutorials, social supports. They'll make their space available for people to come and socialize, have coffee, to do a lot of the same things that they did at Clubhouse. There's a new, my understanding, a new program in the community called Rise Up. I know some of the people at North Central went to one of their grand openings, and if you go to their website, they talk about bringing the community together, bringing the health department together, hospitals, et cetera, to create partnerships, to create and inspire pieces of public art to work together. They have skills groups and classes. Again, NAMI provides a number of resources for people to come together. I have a list here, and I can read through them if you'd like, but we can make this available to you. Looking at what has happened since we've announced the closure, our participation by members has been decreasing for a number of years. This conversation has been had before, maybe not at this level, but the numbers continue to decline. We all expected that once this hit the news and we started talking about this, that we'd start to see the numbers come up again, and that hasn't been the case. We often use lunches as a way to measure what the utilization is. And over the last few weeks, we see days with 3 or 4 lunches being provided. Now, when we have listening sessions and we have people come to parties, et cetera, the numbers increase significantly. But when we go back to day-to-day operations, again, they begin to decline. Even with this, we did look into how it was run in the past. We had Mike Ray come and speak with us about how Clubhouse is run and was closer to profitability, or profitability is not the right word, sustainability is the right word. And it was run differently. It was a limited service. It was only a few hours a day. It wasn't every day. And then the second half of the day was spent in case management services. And we provide case management services in other locations. Also, some of the funding they used at that time is not necessarily available to us. And it was a different Clubhouse. I think it's gone through a number of transformations. And when we talk to other people that were involved in the past, there does not appear to be an answer to have North Central Healthcare run it efficiently, effectively, and with the flexibility needed to be, I think, relevant. There's a lot of community support here, and I keep bringing up Mike's name, but he has had a talk with a number of people in the community. I think the last time he talked, we talked, he said he probably potentially had 20 people in the community that were willing to be board members if he were to start something. And I told him, I'm 21. This is something I believe in. I think what it does for people as they're progressing through their recovery is phenomenal. But I don't believe North Central Healthcare is the place for it to be. If we do continue with Clubhouse, it will be re-envisioned. The current facility, staff have started to move on to other locations. Some of the arrangements we had just didn't make sense. I think I mentioned before, I believe I did apologize if I didn't, I'll say it again. Some of the arrangements where we would have people work in certain locations, if a member didn't show up to work at that job, we'd have to take a staff member to go work that job for them. It's not sustainable in the way that it's been. Making space available, making alternative opportunities for people to engage, those are things we can do. Mike Frankel has decided to move on to a new position, so we really would be starting from scratch. I don't think, and I'll speak for myself, but I think some of this is speaking for North Central Healthcare also, that North Central is the best place for this. We should look at helping the community find ways to fill the gap when Clubhouse is gone. And this list, MCLIT, Council stepping up and offering some opportunities, the members coming together, they've already scheduled a Christmas party and are working on connecting with each other outside of this program. I would like to see, us, as well as the community, support these efforts and support Mike Frankel or these other organizations come together and fill the need. I'm happy to provide more specifics.
Yeah, thank you for all of that. So just a clarification for everybody here. Where it stands right now, Clubhouse will be closing this month, is that correct?
October 17th.
Okay, so that will be the last day because the staff have moved on.
I'm in the process of doing so.
Okay, thank you for that clarification. So are there questions? Questions, Supervisor Crosse?
Yes, I could suggest some other measures or opportunities for some of these people to get together after October 17th. I've led a couple of support groups for people with disabilities, and they were located in restaurants. They met in restaurants or at the library. And we had the groups that I led as a chair of the several different support groups was we met once a month at the library. But it might be possible if there was somebody to step up to maybe chair a support group where they could maybe meet weekly for a few hours or an afternoon or even an evening at the library. That might be something that might be possible during a transition to maybe something that might be more fulfilling.
And we absolutely, I think North Central, it's imperative that we play a facilitator role in helping connect people to other services. We will provide this list, or Mike has been a tremendous champion from Clubhouse for a long time. And he has been reaching out to these resources and providing these to the current members. And we are happy to take other opportunities that avail themselves and make resources available on our website for Clubhouse alternatives in regards to the different services. So anything else that could be provided, we'd be happy to add to that list. And I hate saying all this with my back to the Clubhouse members. I just wanted to point that out. I apologize that I'm talking about Clubhouse and not able to communicate with you as I'm speaking. One last thing I guess I'll bring up. There's a lot of discussion about crisis and CART and overlap with Clubhouse. I would say there's not much overlap. We talked about 3 programs today, and North Central provides dozens of different programs throughout the whole spectrum of recovery. And I would say that although this is an important part of the overall process, there's not much overlap. These are very, very different issues and dealing with people in very different places in their lives. Mike, did you want to say anything? Put you on the spot since Mark brought you up here.
Well, again, I thank you guys for your support. I had to make a very drastic decision for myself, and it's something that we encourage our members to do sometimes too. You know, we have to look out for ourselves and move forward. So that was the reasoning behind me making a decision and soul searching to move on to something different. And surprisingly, a lot of these members back here have my back. They understand that. But they also know that I've not given up and I've not thrown in any towel to pursue what the passion is about what they need, because I know what they need. I've been a clubhouse staff member for 22 years. This thing has been around since 1948. This thing didn't exist all these years just to exist. I mean, it's proven, it's evidence-based, it's needed. It's fulfilled a huge gap in this community between a lot of different organizations and programs and things. And the members know, and I think we know that, you know, a separation from an hospice agency and an ideal clubhouse does survive freestanding with grant writing and fundraising and ways that we can fund it outside of rules and guidelines and policies and things that an hospice agency has to implement in order to protect themselves. So I have been pursuing what could it look like moving forward, and I do have a lot of support. This thing became pretty political. I appreciate Mr. Cavelli reaching out and scheduling the listening session, and if we enlightened any of you into what mental health and mental illness looks like, I think we did. Open your eyes, you know, before we make decisions. But you can be sure that I'm going to try to figure something out. But again, I had to take care of myself, and that was a tough decision to make. With so much uncertainty and not knowing where things were going to be and what decisions you would make and the overall board would make, I couldn't wait for that. I have a life, I have a family, I have, like all of you, and like them. And they couldn't wait any longer either, because we just kept sort of promising false hope, maybe in a way. But I have always give hope tattooed right on my arm, because that's what I believe in. And I'm going to keep giving these guys hope somehow. So maybe some of you in this room will have my back moving forward, but maybe I'll be here one day doing a presentation on a new clubhouse. You know, we're already working on a new name, and I can apply for my own nonprofit 501c3 today if I want, and I'm looking into that. So stay tuned, because Wausau needs this, the surrounding community needs it, and it's going to happen. And if I'm the forefronter, so be it. We're not going to call it Frankel's, I forgot what we were going to call it, Frankel's Friendship House. That's not going to happen, because it's not about me. But our members came up with some really incredible names. And Catherine, I'm kind of leaning towards your Granite House. So we'll see. But again, I thank you all for learning a little bit more about things and taking the time to be supporters and come to that listening session and listening to them, because like I shared in the last board meeting, sometimes people just want to be heard, and we can lend them an ear, and that's what we did, and that's what you did. So I thank you for that.
Thank you, Mike, and thank you so much for your service to our community for so many years. It's really appreciated. Supervisor Crosse, you have a question?
Yes, I also want to thank you, and I'm sure everyone appreciates all the work that you've put into this. The founders, I know one of the founders of Community Corner Clubhouse, her mother committed suicide, and so she became very involved in the mental health area. Her name is Marie Steckbauer. I don't know if you know of her or not, but I met her because she and a group of other people were leading a meditation group every week, and which was really interesting to go to. And there were several prominent people in the community, some professors from the extension who also were there. So anyway, I really feel bad for you that this is discontinuing, but hoping it will emerge in another form again. Thank you.
So the agenda item does state other NCHC programs. Would you guys be able to give an update or just some information about the Adult Day Services program? I think most of us did receive an email from a person that has a child that uses the program, so we were looking for an update on where that stands.
Yes, thank you. The Adult Day Services program is one of many programs we provide at the North Central Healthcare Campus. And it is for those who are challenged in many different ways with cognitive abilities. Currently, or recently, up till recently, the program was housed at Northern Valley Workshop. It was a sheltered workshop program where those individuals could go who were not quite ready to be in the workforce, but they were capable of some kinds of work. And so they were enrolled in the sheltered workshop at Northern Valley. Northern Valley has their own workshop, and the pre-vocational program for North Central also was out there at that site. So when we made a decision to close the pre-vocational program, we looked for where those individuals would go. And actually, we've already closed the program. And here's what happened to the staff members, all except one, were picked up by North Central and moved over to other programs as employees. One employee went to Aspirus, I believe, and was given a job at Aspirus. There were 52 clients in our pre-vocational program. One retired. 12 went across the facility, if you like, to Northern Valley's sheltered workshop program. So they just simply went from one side of the building to the other side of the building to work for Northern Valley and subsidized employment. The remaining 39 individuals chose to go to our Adult Day Services program. We call that ADS. That is the program that's operated on a campus at North Central. And the latest development in that program is that in mid-November, we are going to take our Adult Day Services program with these additional clientele and move them into the clubhouse facility. So we think that's actually a more efficient use of that building, because the average attendance there will be somewhere in the 50s to 60s on a daily basis. Right now, Clubhouse accommodates, as you heard from Dr. Guthrie, maybe anywhere from half a dozen to a dozen or 18 people a day, including maybe 4 or 5 for lunch sometimes. We're going to put 50 or 60 people into there, in a very important program for serving those who are developmentally disabled and cognitively unable to function in other places. We used to call it the adult daycare. We don't call it that anymore, but it's the same principle. This is a place where people can go who need to be taken care of during the day, in between the time when their families cannot be there. So we have that program scheduled to move into the clubhouse facility with some modifications to the building to accommodate a larger number of people. So that is the plans for our adult day services, and that is what happened to our pre-vocational program. Similar thing happened in Lincoln County, but I won't get into the details. We had Lincoln Industries up there, which only served about 20 people between Tomahawk and Merrill. And those people have been transitioned to 2 private programs, subsidized employment programs. And the staff, again, have been transitioned back to North Central. So that's the update on our adult day services and our pre-vocational program and Clubhouse. So it's all works together.
Thank you. And I'd like to make a comment or just put this out here that I hope with the move to a different building that it's being done thoughtfully and that staff is working with families and the people that care for these people to understand what the needs are at that space. Since we're going to make the move, let's do it right. And I hope that can be done.
Right.
Are there other questions for the staff at North Central Healthcare? Okay, so then we will move on to thank you both for joining us today and sharing that with us. Item 7B, the Cdbg Coronavirus Grant Amended Budget Request. And I believe Administrator Leonard.
I'm going to start, and then Vicky's going to cover all the important parts. So just setting a little bit of context, the Community Development Block Grant that we received was relative to the pandemic. You may recall we applied a number of years ago, and it comes with really 2 specific aims of that grant program, and Vicki will talk about our utilization of it in just a little bit and what our proposal is. But it was to address impacts to small businesses as a result of the pandemic, and also impacts to individuals in terms of housing, whether they were rental housing was impacted or home ownership. And Marathon County was fortunate. We received a $1 million grant, $500,000 for the small business program I referenced, $500,000 for the housing initiative, and then we also received $100,000 of that was for administrative expenses. We suballocated those grant funds through our proposal. $500,000 relative to housing was going to be administered or suballocated, I should say, by the North Central Community Action Program, and then the small business program was going to be overseen by McDevco, the Marathon County Development Corporation. We've seen, as you likely have seen in your own lives and through the media, there have been a lot of programs that have been really aimed at addressing those 2 issues. And what that's led to is that some of the funds that we've been attempting to deploy haven't been as utilized by the population that I think when we applied for those funds, we were hoping to really deploy them to make an impact. And rather than hold on to funds and that we're not utilizing, our thought and our request of you today is really to talk about what it might look like to essentially return some of those funds through that process, because quite simply there are other funding mechanisms available for those people. The reason Vicky's going to handle all the important pieces is because she's going to handle all the important pieces to this point. Her department has overseen the reporting relationship. Social Services has been the department contacting McDevco, working with McDevco and North Central CAP to make sure that our grant reporting is done appropriately, and she'll give you an update on what we've utilized and what our next steps may look like.
Okay, so we were contacted by DECR, which is a federal agency. And what does DECR stand for? The Department of Energy something? I don't even know. That's terrible. Lance will find it while I'm talking, but they're the people who are the oversight for the grant. And they were asking, because they could see the level of spending, if we would be willing to return some of the money so that they could redeploy it to other entities who are spending more of it. And so we contacted our partners, and McDevco wishes to keep the remainder of their money, which is about $320,000, and they are going to make every attempt to continue to spend that through the duration of the grant, which is May 2023. And North Central CAP has only spent like about $12,000, if you recall in our last discussion. And the reason for that is because the further out we get from the height of the pandemic, the less likely people are able to document that their struggles with rent or mortgage assistance has to do with the pandemic. And the amount of requirements that they have to fulfill to receive the grant, especially in the rental or mortgage, is really quite high. And so North Central CAP is not anticipating that they will need to use any more money. They haven't had additional requests for this particular source of money for reasons that Lance had shared as well. And so the request in North Central CAP is saying that is completely appropriate would be to return the balance of their money, which is the majority, of $488,000, and then correspondingly for us to return a portion of the administrative money, and that we would keep $52,000 and return $48,000 of the administrative money as well, so that can be repurposed. So that is what we are recommending to do, so that the money can again be repurposed for a project that could utilize the money.
So I was able to find what DECR stands for. It's the Division of Energy, Housing, and Community Resources. But we wanted to bring this to you. This is just here for education today. It's not for action, but we wanted to update you. As Vicki said, we can talk about our programs and the services that we deliver. One of the really big things that we focus on, and certainly at social services they focus on, is, we are trying to be very good stewards of the funds we've received. And if they can be better deployed through the Wisconsin Department of Administration and make more of an impact for what they were intended to, which is pandemic response, our thought is to pursue what it looks like to return those funds. But we wanted to bring that here and get your feedback. And if you're in agreement with that, we'll develop the plan, understand what we need to do to make that happen. But that's currently the state of things. I think we've done, again, fairly well, and McDevco is confident they're going to continue to try to utilize those funds. But on the housing side, just for an example, the state of Wisconsin has multiple programs. One of them that we also work with is the Help for Homeowners program that's administered through our treasurer's office. So there's a lot of money that has been made available for individuals, like Vicki said. And the further out we get from the pandemic, that nexus that the individuals to receive these funds would need to show, it's our judgment it's less likely that they'll be able to do that. And so our thought process is, let's return those funds. But certainly we're open to feedback. If you want us to go back to North Central CAP and say, hey, give it another go, we'll try. But I think they've been doing a good job to make those funds accessible. There's just a lot of other money that's available for people to address these issues. That's true. That's a great point. Some is easier to access. So there's a lot of reporting, not only that Vicki and her team and North Central CAP and McDevco need to do, but the individuals applying for these funds likewise need to have solid documentation to utilize these funds. And there are other funding mechanisms where the documentation is less onerous, and that makes total sense that individuals are going to avail themselves of those resources as opposed to these.
And I think one thing you didn't mention either is that some funding sources don't allow a double dipping aspect of it. So if someone already got funding from another program that was federally funded or state funded, then they don't qualify for this money. Supervisor Crosse, go ahead.
Thank you. I don't quite understand why North Central CAP wouldn't be using that money with the problems with homelessness and alcoholism and drug addiction. I can't understand why they wouldn't be using those funds.
The reason for that is that for this particular program, it's very targeted, limited only to a problem with a rental or mortgage due directly to the pandemic. So all of the other conditions that you mentioned would not qualify somebody for this program. It's only related to there was a struggle with being able to afford rent or being able to afford your mortgage directly because of the pandemic. And you have to be able to show that causation in order to get this particular fund of money, which is why it's been really difficult by the time that the grant itself came out and by the time we processed it and was awarded it. a lot of time had passed, and now, of course, it's even much more time. So for some of the other populations that you mentioned, there are other housing programs that are available that they are applying for and could access, but this one has that caveat, it's only about the outcome of the pandemic.
And because the city of Wausau is an entitlement community of its own for block grant funding, this funding that the county received couldn't go to any residents in the city of Wausau.
That great point. One other thing to add, when I talked about there's not only other programs that people can avail themselves of for funding, you may all recall as a result of the pandemic, there was essentially a moratorium placed on evictions for individuals. So again, another potential way that this issue would be alleviated, and I shouldn't say alleviated, but addressed. There were a lot of individuals that were renting that were certainly impacted by the pandemic, but with the moratorium on evictions, it really caused landlords and renters to sit down and try to come to some sort of agreement on, okay, how can we set up a payment arrangement that's reasonable? We have a program here in Marathon County that we put in place well before the pandemic. It's a mediation program specifically for evictions, because at the time the thought process was evictions take up a lot of court time. Once you get evicted, it may be interesting for you to know that, as Vicki said, if you have a bad rental history, it's tough to rent again. So we identified this mediation program as something we could do to free up court time, to deal with our justice system issues, but also help people from finding themselves in an unenviable situation where their rental history is negatively impacted. That, too, is something that in Marathon County, I believe it would have a positive impact on making this program perhaps less amenable to people or less necessary, so they could not only choose help for homeowners, some of the other programs that we've mentioned, but maybe that need wasn't so acute, in addition to the fact that, as Chair Van Cray referenced, the city of Wausau is exempted from this program, and they have other funds and other programs that individuals within the city would be able to access.
Thank you.
Supervisor Covelli?
Thank you, Madam Chair. Question on, have we advertised this program from the beginning for people to access those funds?
Short answer, yes, and that's precisely the reason we chose North Central CAP to be the organization to head this up. As we've talked about, I don't know if it's been at this committee, but certainly at Extension, Education, Economic Development, the county doesn't have a housing department. We certainly address housing, like Vicki talked about with Family Keys, within the programs and services we offer. North Central CAP is the place that if you have a housing issue in Marathon County, that's who people are going to go to. So it seemed a very logical fit, and they advertise all of their other programs, and they have advertised this as well. I don't think it's an issue of if we go out and do a marketing campaign or have some targeted advertising, more people would avail of themselves.
Sure, thank you. I'm for giving money back anytime, so I'm on board with your program. Yep.
So then, I mean, if that's the general consensus, we'll come back with a plan as to how to clearly do that, and I think Vicki has some information on what that's going to look like.
So it's really not that difficult. It's actually that we can just let them know that we can return the sum of money that they were suggesting, because Decker's the one who's looking at our spending, right? So they made a suggestion, and if that was okay with our partners, basically it can just happen. There doesn't need to be any approval by the Health and Human Services Committee that's acting like the public participation committee for this grant. It can just happen, but we did want to get your feedback and have you understand what the status of the spending was. And sooner rather than later, so the other entities have more time to spend it as well.
Thank you. Were there any other comments or questions, or I guess objections? Because it seems like there's sort of a consensus, but if everyone or anyone has a concern, you should hear it now. Okay, thank you guys.
All right, just then to be clear what our plan is from the operational and administrative side, we're going to do what needs to happen to return those funds so they can be utilized. Thank you very much for the conversation.
Thank you. Item number 8, next meeting time, location, announcements, and agenda items. 8A, committee members are asked to bring ideas for future discussion. 8B, next scheduled meeting is Wednesday, November 2nd, 2022 at 3 p.m. That should be item number 9, adjournment. I will take a motion. Motion by Leahy, second by Niemeyer. All those in favor say aye. Aye. All right, we are adjourned. Thank you.